Inexpensively, Lillian Olo sits outside her house. 2 years ago, she would have been busy at work earning her keep. But her battle with kidney failure has reduced her life to this state of inactivity.
At the moment, I cannot work. I cannot do much. Everything is at a lower pace, whereby you feel like there's something wrong somewhere, but there's nothing you can do.
She knew she had kidney failure 2 years ago, but her trouble started almost 4 years prior to that. She was falsely diagnosed severally.
I would go to the different hospitals and they would tell me that it is maybe pneumonia or malaria or typhoid. So I treated the typhoid, the wrong disease for a long time before they diagnosed the disease.
Her life now revolves around dialysis sessions twice every week to clean up her blood, a function normally undertaken by the kidneys. It is an expensive affair, one made even more grim by her unemployed status.
Going dialysis, I go twice a week, and that is still expensive. It's around 19,000 per week.
Even as she struggles physically and financially through the dialysis sessions, her eyes are set on the ultimate prize, a kidney transplant. Sheila Kipsura is luckier than Lillian. After suffering renal failure for 3 years and undergoing dialysis for 1 year, her ex-husband donated one of his kidneys to her. The transplant was carried out here in Kenya.
Operation is not the whole thing. After the operation is the main. That's where now you'll have a bit of some difficulties because of the medication, because it's a life thing. And the medication you are given, it's a life thing. You never stop using them.
While dialysis may offer temporary relief for patients suffering from kidney failure, experts contend that the only sure way of treating this ailment permanently is by having a patient undergo a kidney transplant, a phenomenon that is yet to gain currency in Kenya, largely due to financial obligation and lack of people willing to donate their organs.
This is a poor way of treating kidney failure, and therefore the best way of treating kidney failure is kidney transplantation. That's why we are pushing more and more to have more kidney transplantation done in Kenya.
Ideally, for kidney transplantation, health experts insist on donors being immediate family relatives because the likelihood of finding a match is higher. This also helps in controlling possible coercion prohibited by the Human Tissue Act.
So any donor, that is anybody who is willing to donate, that can be able to help out to donate for the patient,
The Health Act does not stipulate the rules guiding kidney transplantation, but we are hoping that with the new health bill that will be put in place.
The donor matter notwithstanding, there is the added challenge of raising the funds to have the transplant carried out. Currently in Kenya, only Kenyatta National Hospital, Moi Referral and Teaching Hospital, the Aga Khan Hospital and the Nairobi Hospital offer these services. The public facilities charge the least, $500,000 shillings for the procedure, while the private ones charge between 1.5 and 2 million shillings.
The NHIF will be able to support transplant patients, and not only the transplant, the medications after the transplant, because a lot of patients fail because they're not able to afford the medications after the immunosuppressants, and then they reject, and then they either die or go back onto dialysis.
The financial burden is, however, lessened for those seeking dialysis services. NHIF now pays for dialysis sessions twice a week for patients. This, coupled with efforts by the government to increase the availability of renal centers in the country, has lessened the burden that was previously taking a strain on the available resources.
Will be available throughout the country. What is going to be a major challenge will be the personnel to manage those machines, both the kidney specialists and the nurses, because dialysis machines are usually managed by nurses, and the doctor usually supervises the process to be done in a proper way.
There are currently 3,600 kidney patients on dialysis in the country compared to 400 patients initially. Currently, there are 30 specialists against a nation population of 42 million. 5 of these are pediatric kidney specialists. Brenda Wanga, NTV for the Health Assignment.